สบายดีมื้อนี้เฮามาเรียนรู้เดือนแห่งการตระหนักความรู้เกี่ยวกับโรคหลอดเลือดในสมอง1ใน4คนจะป่วยเป็นพยาธิเส้นเลือดสมองพยาธินี้เป็นอันดับที่5ของการเสียชีวิตทุกๆ40วินาทีคนในอเมริกาจะเป็นพยาธิเส้นเลือดในสมองนี้ทุกๆ3นาที14วินาทีคนหนึ่งจะตายคนเอเชียจะเป็นโรคนี้ในอายุยังอ่อนเปรียบเทียบกับเสื้ออื่นประชาชนอาซีมีความเสี่ยงสูงต่อการเป็นพยาธินี้มีอัตราการตายรวมสูงสุดจากโรคสโตรกนี้ได้
May is Stroke Awareness Month, and I have clinician at the Texas Health Hospital. We're going to start with Ricky. Ricky is a supervisor for the neurosurgical ICU unit at the Texas Health Resource Hospital, and she was a nursing instructor as well. Stroke, as we know, is 1 in 4 Americans have stroke. It's the 5th leading cause of death. Ricky, what are signs of a stroke and how does someone know if they're experiencing stroke symptoms?
So that's a good question. One of the acronyms that we use when we talk about stroke and stroke symptoms is be fast. So the B is for balance. Are we having balance issues or maybe we're having a severe headache? E is for eyes. Some patients will experience loss of vision or changes in vision.F is for face. Are we symmetrical? Is there a facial droop? A is for your arms. And so with this, when we hold our arms up, are we weak on one side? And then S is speech. Some patients will have slurred speech or maybe have trouble speaking in general. And then T is time. And so we say time is brain. So rapid getting somewhere and getting interventions is so important because we cannot undo the loss of brain tissue.
Thank you, Ricky. And Haley is also nursing supervisor for the night shift for the neurosurgical ICU unit at Texas Health Resource Hospital in Fort Worth. Haley, when someone is identified as having stroke outside the hospital,Is it better to call 911 or is it get the family to drive them to the hospital?
It's definitely better to call 911. So like Ricky was saying, the last letter in Be Fast is T for time. Time is brain. The quicker you get to the hospital, the quicker we can evaluate if we can intervene, and then meaning that we can save the brain tissue and be able to burst open the blood vessel that's clotted.
Is there a time frame what we can do for the stroke patient?Yes,
so we want to ideally intervene within the first 4 hours of onset of symptoms. So we're able to give you a medication called TNK and or take you down for something called a mechanical thrombectomy.
And that's why it's important, right?
Very important to call 911 and to have emergency medical services come out and take you to the hospital.
Okay. Anything else ladies want to
add?Stop smoking and control your blood pressure.
Yes. Thank you so much for your time.
All right. Bye.
We are with the stroke clinician for Texas Health Resource Fort Worth Hospital. Texas Health Resource Hospital is a comprehensive stroke center, a top level of the stroke care. These are the stroke clinician and stroke coordinator for our hospital. And I'm going to start question with Christy Rodriguez. Christy,was voted top 100 nurse for DFW in 2024. Christy, can stroke be prevented and how?
Well, yes. Stroke can be prevented by knowing your risk factors for stroke. So high cholesterol, diabetes, hypertension are some risk factors. So just regular checkups at your doctor and treating your risk factors can help prevent stroke.Thank
you so much. And we have James Charles. She's a stroke clinician as well. She's a legend in the world of neurology. She knows everything. She's also a clinical of nursing instructor. Jen, what changes can one do to prevent stroke?
Exactly like Christy said, control your risk factors. Don't smoke. Watch your cholesterol, eat healthy. keep your blood pressure under control. If you have atrial fib and you're on blood thinners, make sure you take your blood thinners regularly. Don't skip any doses.
It's good point.
And check in with your doctor regularly.
Yes. Okay. And we're going to go to Leora Joyner. She's a coordinator. She oversees the whole stroke program at the Texas Health Resources. What can we do after we have stroke to prevent future stroke, and what are some resources for stroke patients?
So it's really important to make sure you're taking your medication, like Jane had said. So if you're on a blood thinner, don't stop taking your medication. Don't run out of it. There's tons and tons of resources out there to get medication at a reduced or even free. So talk to your doctor about making sure that you're able to afford your medication. You want to make sure you do your rehab exercises because you want to have the best outcomes. And so the best, the amount that you regain in the first 3 to 6 months is going to be your best recovery period. And to make sure that you're doing what you're supposed to do. So keeping those blood pressure down, don't smoke, exercise, eating right, and following up with your doctors.
Yes. Thank you so much. This is so insightful and very useful information. Thank you.